Picture the world without vaccines. There would be widespread epidemics, unstoppable diseases, and death. Thanks to vaccines, we are able to protect ourselves. Vaccines are medicines, but unlike those that cure or treat diseases, they prevent them. Jamaica has long been engaged in this preventive mode of healthcare, even enacting laws to enforce compliance.
Jamaica has had a very robust, expanded program on immunization, which has allowed us to have very high coverages for our vaccines.
Since the country's first expanded program of immunization in 1977, Jamaica has eradicated and eliminated many serious diseases. The country had its last case of polio in 1982, the last case of locally transmitted measles in 1991, diphtheria in 1995, and rubella or German measles in 2000. The last case of newborn tetanus was in 2001. Still, this is no reason to let down our guard, as many countries still have annual cases and outbreaks of vaccine-preventable diseases such as measles, which can spread through international travel and tourism.
Jamaica is a well-established tourist destination, and so we have to remain vigilant in terms of the introduction of diseases into the country, and therefore do all that we can to reduce any possible impact on our population.
In early 2015, a measles outbreak in nearby United States highlighted this need to remain vigilant. In response, the Health Ministry launched a multi-million-dollar measles prevention campaign in February. It targets 195,000 children island-wide, ages 1 through to 6, in 3 phases.
Phase 1 will target children attending clinics at the health centers for routine immunization services such as the 18 months booster doses. Phase 2 will seek to capture children at the basic infant primary schools and daycare centers, and Phase 3 will focus on targeted community outreach for those who were not immunized in Phase 1 and 2.
The campaign, which runs from February 16 to May 8, primarily involves procuring and administering additional doses of the measles, mumps, and rubella MMR vaccine.
We will be going into communities to ensure that the children that we have not as yet seen in the health centers or in the schools, that they are immunized.
Children who may have missed their complete MMR doses or any other compulsory vaccines available in the public health sector will be given them during the campaign. Measles is a highly contagious respiratory infection caused by a virus. Symptoms generally appear 10 to 14 days after exposure to the virus and include a fever, dry cough, runny nose, sore throat, inflamed eyes, and skin rash.
It is spread by coughing, sneezing, direct contact with persons who are ill with the measles virus, and also contact with any of the droplets, the materials. This virus can remain alive on surfaces for up to 2 hours. It presents as a non-specific flu-like illness.
Everyone has a role to play in keeping Jamaica measles-free. Parents and guardians are to ensure every child is fully immunized.
The Ministry of Health provides vaccines for children at no cost in the public health sector. This was the case prior to the introduction of the no user fees policy. And continue.
So get your child's immunization card or child health passport ready and visit your nearest public health center or clinic. The current 3-phase immunization campaign is running concurrently in all parishes.
All our health facilities type 3s and above are now designated daily vaccination sites from Monday to Friday during normal opening hours. So parents would need to bring, for children born before 2010, their immunization cards. But we implemented in 2010 the Child Health Development Passport, which have the immunization record. And once they take those, the public health team, which is usually either the public health nurse or the midwife within the clinic, would check, see what vaccines the child would be eligible for, and administer same.
Everyone in the targeted population will be vaccinated unless they can provide documented proof that they have received the completed doses of the MMR vaccine and any other compulsory vaccine. The Ministry of Health has taken the decision to offer the completed dosage of MMR vaccinations earlier. Children born July 2013 and after are now offered the booster dose of the MMR vaccine at 18 months old instead of 4 to 6 years.
It therefore requires that those children who would be 2 and 3 years old, and in the previous schedule, they would be getting their vaccine at 4 to 6 years old. All of those children would be among the group that we need to immunize now.
Under the country's 1986 Public Health Act, all children should be fully vaccinated by their first birthday and get booster shots after that. And all children under the age of 7 must be adequately vaccinated for their age prior to entry to school, which includes nursery and daycare facilities.
It is the duty of every parent to have their child immunized.
Failure to comply with the regulations can result in prosecution in a court of law. The regulations only allow for exemption from vaccination based on medical reasons and not on religious or philosophical beliefs. Prevention is better than cure. Vaccinate today and reduce the risk of infection from potentially dangerous vaccine-preventable diseases.